Well, thank you very much for giving us the opportunity to speak to you today. I have to say, if I were picking my subject to speak about, this would probably be near the bottom of the list, but there we go. So the first introduction is, I am not an expert in technology, but I'm going to give you a perspective on interoperability from the European Connected Health Alliance's viewpoint. So a little bit of an overview, first of all. So I'm going to say a few things about the European Connected Health Alliance so you understand, if you like, where some of our views are coming from. I'm going to give a personal vision about digital health and social care services. I'm going to talk a little bit about interoperability and set up the day for you, hopefully, around various topics to discuss in that sense. I'm going to talk a little bit about the use and challenge of standards. I'm going to give you an international perspective in terms of interoperability projects that we're aware of in Europe and indeed in the US. And then finally, a little bit about what we do in the European Connected Health Alliance in terms of future upcoming events. So the first thing about us, so we're a not-for-profit organization. So our mission is bringing together the future of health, social care and wellness. I might add housing as an integral part of that. So our mantra is about health and social care as an investment in people, well-being and growth. So it's about linking health and social care with the economy. And we're a membership organization, and our implementation tool is ecosystems, which I'll come on to in a second. So our primary functions are about promoting connected health meaning digital health, e-health, m-health, telecare, telehealth, telemedicine. It's about connecting and support for innovators. It's about implementation first and foremost, and therefore scaling up solutions through the ecosystems. It's about business models, and it's about entrepreneurship. It's about acting on public policies on an international basis. And it's about education, communication, and dissemination. So what do these ecosystems look like? Well, we are delighted that Northwest Coastal is one of the UK's existing ecosystems. And what you can see from that is how this works internationally. So we have 8 up and running ecosystems. And the idea is basically to stop reinventing the wheel, whether that's in health or in social care, and transforming or transferring even best practices and lessons learned from one ecosystem to another. And as you can see, the ambition is substantial. We have 16 ecosystems under development across Europe. So we are the only organization in Europe, including the European Commission, frankly, that is genuinely connecting the delivery of health and social care across boundaries. We are, if you like, a disruptive influence in some ways. We are trying to generate global healthcare on the basis that best practice should be universal. It shouldn't be limited to a region, a city, a country, or a continent. And interestingly in there, for those of you who will see, is that we have an ecosystem in New York. So on interoperability, for example, New York links 18 million New Yorkers with all of their healthcare records, their primary care records, their secondary care records, their lab results through a portal. So in terms of interoperability challenges, there isn't much that New York and Barcelona, frankly, have not already done and issues they haven't already faced. So the vision. So why did I come up with this? Well, when I looked at interoperability, I just thought, well, what does it actually mean for me? It's not an end in itself. The goal must be the transformation of health and social care services so they are safe, efficient, and that our health and social care systems are sustainable. So what does this look like? And here are some of my thoughts. You know, to be able to have the facilities that you take for granted when you book airlines or hotels in the delivery of public services. And I've given you some examples, and some of them are clearly, you know, you might disagree with it. You might not think it's important to be able to book your dentist online or your opticians online. But my answer is, well, why not? And right at the bottom of that, Estonia, which in fairness is only a small city of 1 million people, has the X-Road. The X-Road is the delivery of online all public services digitally. So if it can happen in a city, why can't it happen in this region? Why can't Northwest Coastal lead the way and actually have the vision to join up not just health, not just social care, but the lot. Because it makes sense, and this is all about scalable delivery. So for me, this was my vision of why interoperability is important. And then a system view, so clearly it's important, and I have a long-term condition, so I have asthma, so it's important that if I am unwell, that my GP can access any medical records that might be in hospital about me, and vice versa. And if social care is relevant, then it would make sense if they could access the same information in real time. And then I'll come back to the next thing about a summary care record when I go on my holidays. So, a perspective, and I like being real and provoking. So, the vision of the coalition government when they came to power was an information revolution. And I have to say, on that basis, they've failed, in my view. They've promised big, and the ambition is fantastic, and I give it maximum credit. But is it a revolution a few years on? I don't see it. Can I access my medical records online? No, I can't. But there are some very good things happening, okay? And Declan will, I'm sure, be pointing out some of the great things happening regionally. But as an overall position at the moment, you know, we're getting a C. You know, we're not near top of the class. And the real important thing in here is Professor Steve Field, who I have a lot of time for, where he says, the NHS cannot remain in the information dark ages. And my point here for you all is, you need to understand where we're starting from, which is we're the dunce in this particular class in terms of the use of technology. And we need to move quickly to get into the front of the bus, if you like, carrying on mixing my metaphors. So, why? Why is this really all important? And for me, much of this is about digital and data. Okay, and this is all enabling technology. And this is an interesting quote, and I'm not going to talk about it from Bill Gates, about why this data is really, really important. And then looking at the silos, and the problem here is that at the moment we have lots and lots of data. In fact, the NHS has mega amounts of data, going back to 1948. The trouble is we don't intelligently make use of that data. So the real key here is the data aggregation point there, that we've got to start using the resource that we have intelligently. This is the vision of Dr. Oliver Harrison, who was, is a clinician by background, was strategy director at the Health Authority Abu Dhabi, and did some absolutely brilliant pioneering work in this sort of particular area. But this is what he calls closing the health loop, and the data's at the center of it. And what I'm trying to draw back to you and center you on is, as great as this technology is, as great as some of the things we're talking about, it's about health services and social care services. It is about enabling better services. And which countries are leading the way? And this was just to give you a feeling for what it is. I've always believed that in terms of disruptive technology, it's very likely that the developing world will be the biggest innovators because they don't have hospitals, they don't have primary care facilities, so they're going to have to go to digital. Nevertheless, there are some really good examples in the top right of some systems that are starting to do some clever stuff. And shiny is the New York European Connected Health Alliance ecosystem. So what is interoperability then? And as I said, I look at it in two ways. It's technical, it's joining up and making sure that things work together. And it's semantic, it's about information being compatible, being capable of being compared with each other and working together. And then the driver is about IT systems and software that communicates, exchanges data, and the use of that data. So why is it important? So I think I've probably covered this in the sense of driving both the development of health and social care services and the development of global health. So a little bit about this guy, who's very interesting. I don't know, anyone heard Doug Frisma speak? So this is as the slide says, he's the Chief Scientific Officer for, effectively, the US Federal Department of Health. And the introduction to this is that in 2010, the European Commission and the US federal government signed a memorandum of understanding on connected health. We still find that the vast majority of people where we speak do not know this exists. And this is about trying to avoid a fight, like, for those of you who my age or older, between Betamax and VHS, where you have competing standards and systems, trying to join up and agree key standards. So his focus was on standards and then a strategy for the workforce. And one of the interesting things is often the workforce is forgotten, that when you're introducing this new technology, they've got to be able to use it, and therefore it's really key that you start to actually enable. And we're not just talking doctors and nurses, we're talking about care workers and people who are using things like domiciliary care, where at the moment there is an absence of qualifications for those type of workers, but clearly in the future they're going to be key. So when we look at these standards, for Doug, he thought there were 3 work streams. So standardization of terminology, and then I just finessed it a little bit for you. So it's clinical, laboratory, drugs, administrative data, standard messaging structures, and then, interestingly, standard patient-controlled electronic exchange. So in this concept, the interesting thing here is this is patient-control systems, which actually we're not intending to implement at the moment, I don't believe, but it's an interesting observation. So what are these standards? So Doug thinks there are 5. So he has a very interesting story, okay, about standards. He says standards are like toothbrushes. Everybody has one, but nobody wants to use yours. Okay, so one of the ways to look at interoperability is to understand that countries see competitive advantage in having their own standards, which means that the standards will compete with each other and interoperability suffers as people have incompatible systems. So there is a competitive challenge in the marketplace, which we would not support. But in order to make interoperability a bit more meaningful to you, these are the 5, if you like, interoperability standards that I think are at the key of this. So it is about vocabulary and code sets, whether it's clinical or involving social care. It's about the content structure. It's about transporting that data. It's about the security of that data. And then the last one is interesting because it's about how you use the data to bring about services. And this is a European equivalent, and I use this because it's just a very different way of trying to convey many of the same things, where you look at it from different perspectives. So we have a clinician talking later on about why it's important from his perspective. The privacy one, I think, is probably very well known in the public domain. The workflow and then a record structure, probably less so. Looking at examples of stuff that we are currently doing across our network. So I'm quoting you some work in Manchester and then in Northern Ireland around the electronic care record. And I'm simply saying there are lots of work that you can pick up on and learn rather than reinvent the wheel. Around Europe, there's the EPSOS project, and you're going to have the slides, so I'm not going to talk in much detail about this, but this is, at its core, interoperability across European countries of electronic patient records. And there is much learning and published data in reports about how they did this and the issues they faced. Similarly, in terms of the EU-US, the biggest thing they have done is the Trillium Bridge, which is the summary care record for me when I go on holiday in the United States and for any United States citizen that goes to Europe. So the idea is that you would be able to access your summary care record wherever you were. So huge amount of work about, so what clinical data needs to be in the summary care record, all the standard issues around the vocabulary that's used, how the system works, the interoperability and the training for staff. So there's huge learning in this project for people. And the real vision, because I started off with my personal vision, the real vision I think is actually, Samsung expressed it for me. This is about preventative health. Because if healthcare systems are going to be sustainable, we have to make people avoid illnesses in the first place, and those of them who've got conditions like me remain stable. So it's about preventative health. And what this picture does is it gives you an idea how all of these services and systems need to be coordinated and linked up in order to deliver effective preventative care in the future. So, in conclusion, I like the term that's called meaningful use in the United States. So there are financial incentives given to providers around meaningful use of IT and technology. And if you don't have meaningful use in your systems, you get penalized. But the real important point for me here is the why. The why are you using of technology and why interoperability? It's these 5 things. This is what we're trying to deliver. This is what it's all about. Improving quality, improving safety, improving efficiency, engaging patients and their family, improving care coordination, improving public health and reducing disparities, ensuring privacy and security. This is the mantra that we all need to hold dear to in everything that we do around this particular agenda. So some things about what the European Connected Health Alliance has been up to. So in May, we had our ecosystem in Greece. And some of you say, well, why Greece? Bankrupt country. Why would you be doing technology in Greece? Well, the answer is because the European Commission and the Troika mandated connected health in order to make cuts in public health services. As a consequence, Greece is the first country in Europe that has 100% e-prescription. So one of the things we must do is not be arrogant and believe that we cannot learn from countries that we might not anticipate where they were particularly advanced. You'd be surprised where innovation emerges. We've just done another e-health marketplace for the European Commission in Brussels, and some really interesting stuff I was just saying this morning around medical health records, electronic health records, and a new law in Flanders allowing patients to effectively allow access to hospitals and primary care records, or to veto it. Things that are coming up, we're in Boston with the US Federal Department of Health and the EU Commission later this month on the 5th collaboration on connected health. And then our big event, we're in March, when we're back as the partner for Mobile World Capital, where there'll be 85,000 people around technology and mobile communications, and we're running the health and wellness event at that conference. So if you want to get involved, we'd be delighted if you do. So the last thing is the Connected Health Alliance in China, which we've announced. We're incredibly excited about this because China has 92,000 hospitals. The scale of challenge for them around this agenda is enormous. We believe that by founding the Chinese Connected Health Alliance with the Department of Health in China, the European Connected Health Alliance becomes the gateway to the China and the Chinese market and the Far East market. And similarly, Chinese businesses accessing and wanting to do business in Europe, we become a gateway. So that's enough. I'm here all day, so if you want to talk to me, please do. Thank you.